Right now, you're probably doing all of the right things to help manage your sciatic pain. Stretching, taking medications, maybe even trying to rest it away. But here's what nobody is telling you. These solutions aren't fixing the root cause and could actually be making your pain worse. For the past 15 years, I've helped thousands of people get rid of sciatica for good, without surgery or medications. In this video, I'll walk you through my exact 6-step process to permanently eliminate sciatica, from pinpointing the true cause with a precise diagnosis to performing specific corrections for commonly missed causes of sciatica that people often overlook. And at the end, I'll share a real success story of someone who thought they'd never get better until they followed this plan. Be sure to watch all 6 steps because missing even one of them could mean your sciatica becomes chronic, keeps getting worse, or never fully improves, leaving you stuck in pain for years to come. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I've been helping patients overcome chronic lower back pain, sciatica, and neck pain, all without medication, using specific chiropractic techniques. If you're busy with work or home life and dealing with chronic spinal conditions, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. Before I dive in, subscribe to my channel if you want more tips and strategies to help you achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgeries. Sciatica isn't just back pain. It's a nerve pain that radiates from the lower back through the back of the thighs and down one or both of the legs. It's caused by irritation or compression of the L4, L5, or S1 spinal nerves, which contribute to the sciatic nerve, or by direct compression of the sciatic nerve itself in the buttock region. If you're suffering from sciatica, you know how debilitating it can be. Simple activities like sitting, walking, or even sleeping become excruciating. Many people describe the pain as sharp, stabbing, or electric, and as often feels like there's no escape. For some, the fear of this pain never going away is worse than the pain itself. You've likely tried everything: medications, injections, physical therapy, and yet nothing has truly worked. That's because these treatments don't address the root cause of sciatica. The good news is there's hope. With the right approach, you can identify the true cause and start on a path to lasting relief. Let's break down the 6 steps that can get you there now. Step 1. Start with a precise diagnosis. The first step is understanding the exact cause of your sciatica. Not every case of sciatica comes from the same issue, and without pinpointing the root cause, it's impossible to fix it for good. We start with a comprehensive consultation where we'll dive into your symptoms, medical history, and lifestyle factors. Then we'll perform a full spinal and postural assessment to identify misalignments or imbalances that could be contributing to your pain. Sciatica can have several different causes: a tight piriformis muscle compressing the sciatic nerve, pelvic or sacral imbalance, a lumbar disc bulge or herniation at L4-5 or L5-S1 causing nerve compression, misalignments in the lower lumbar spine, particularly at L5 and the sacrum, or even more serious conditions like spondylolisthesis, where a vertebrae shifts forward or backward. We may also perform special tests such as muscle strength and reflex assessments, or take x-rays to help visualize these misalignments. In some cases, an MRI may be necessary, but this thorough diagnostic process ensures we know exactly what's causing your sciatica so we can treat it effectively. Step 2. Specific chiropractic adjustments. Once we know the root cause, the next step is applying precise chiropractic adjustments. These adjustments target areas like the sacrum, pelvis, and lower lumbar spine to restore proper alignment, improve spinal function, and reduce pressure on the nerves. These corrections aren't random. They're tailored to your specific exam findings. They're also gentle and effective, ensuring that sciatica caused by spinal misalignments doesn't become a lifelong problem. Without these adjustments, any other treatments may only provide just temporary relief. Step 3. The game changer: non-surgical spinal decompression. Imagine living with sciatica so severe that you can't get through the workday or enjoy simple moments with your family. You've tried everything, but the pain keeps coming back. It feels hopeless. Now picture this. You're lying on a comfortable spinal decompression chair, and the machine gently stretches your spine. You feel the pressure easing as your discs begin to heal. With each session, the pain that used to control your life fades away, and you can finally move without fear. Non-surgical spinal decompression is designed for cases where sciatica is caused by herniated or bulging discs. It's backed by research and works by creating negative pressure in the spine, allowing bulging discs to retract and relieve nerve pressure. Patients love this treatment because it's comfortable, safe, and effective. It has a high success rate for reducing pain and restoring function. For many, this step marks the turning point where hope replaces that despair. So far, which of these steps, diagnosis, specific corrections, or spinal decompression, stood out to you the most? Let me know in the comments or share any questions you have about these steps. I'd love to hear your thoughts. Step 4, introducing home exercises and stretches. Now that we've stabilized the spine and reduced inflammation, it's time to start adding in home exercises and stretches. Starting with stretching or strengthening too early can actually worsen sciatica by aggravating unstable areas. Unfortunately, many patients are told to stretch without proper diagnostics or spinal corrections, which delays healing. Once the corrections are holding, we start to introduce specific exercises to relieve pain, improve flexibility, and strengthen the core. Exercises such as the knee to chest stretch, piriformis stretches, seated pelvic mobility exercises, bird dog exercises, prone planks, and lumbar extensions. These exercises are simple, effective, and designed to prevent sciatica from returning. I have an entire video dedicated to stretching exercises that you can do at home. You'll find the link to this video in the description section. But remember, these exercises are not the full 6-step treatment. You really must find out what's causing your sciatica and get appropriate spinal corrections, and if necessary, spinal decompression to truly fix the problem at its source. Step number 5, progress monitoring and reassessments. Recovery isn't a straight line, it's a journey. That's why regular progress exams are critical. These reassessments allow us to measure how far you've come, adjust your treatment plan as needed, and set realistic expectations for continued improvement. Ongoing monitoring not only keeps you on track, but also prevents relapses. When you know you're making progress, it builds confidence and motivation to stick to the plan. Step number 6, maintenance care for lasting relief. After achieving significant improvement, often 80 to 90% within just a few weeks, it's essential to maintain your progress. Maintenance care includes periodic adjustments, usually about once a month, to ensure your spine stays healthy and balanced. Without maintenance care, the misalignments or issues that caused your sciatica could return. By staying proactive, you can prevent flare-ups, keep your body functioning at its best, and enjoy a pain-free lifestyle for years to come. In a moment, I'm going to share with you Rafael's story, who suffered from sciatica for over 2 years, and you'll hear about his remarkable recovery. Stay tuned. In the meantime, if you got any value from these 6 steps or learned something new, please like and share this video. It could help someone else find relief as well. Now, Rafael came to see us after suffering from left sciatica for over 2 years. It was causing him excruciating pain every time he'd been over to play or lift his young children. Before he came to our office, he had tried stretching and pain medication, and had even been recommended to have surgery by a neurologist. When he came in, we performed an exam, discovered that his sciatica was caused by a disc bulge at L5-S1, compressing the sciatic nerve. He went through our 6-step process, just like I outlined in this video. For him, we focused heavily on spinal decompression as it targeted the disc bulge, which was the root cause of his pain. Within just a few weeks of treatment, his sciatic pain had improved significantly, and he was able to start lifting and playing with his kids again. Now he does maintenance care. We see him every 3 to 4 weeks to continue locking in the corrections and supporting the healing we've accomplished. Just like Rafael, if you've been struggling with sciatic pain and feel like nothing works, don't lose hope. When you identify the precise cause of your sciatica, there's a clear path to healing. You don't have to let pain control your life. With the right approach, you can get back to doing what you love. Recovery is possible. It just starts with understanding your body and taking the next step to move forward. Now, some people who suffer from sciatica have trouble sitting, standing, or even sleeping. If that's you, I've created a video where I share my top tips to help you find relief in these everyday activities. You can watch it here now.